Ever felt a sudden, unexplained twinge in your chest that you just brushed off as nothing? What if that little signal is your heart trying to tell you something serious? Today, we're diving into the first signs of heart disease that you really can't ignore. Think of it this way. While many of us go about our day without a second thought, our bodies might be sending us subtle warnings that add up over time. Heart disease is the leading cause of death in the United States, and the earlier we catch these signs, the better our chances of stopping a serious problem before it strikes full force. I'm not here to scare you, but to empower you with knowledge that could make a huge difference. In the next few minutes, we'll break down common warning signals backed by research, share real-life stories, and discuss practical steps you can take to protect your heart. By the end, you'll have a clear understanding of what to look out for, and trust me, this is something you want to stick around for. Imagine this. You're in the middle of a busy day, and you notice a little discomfort in your chest. You think, it's probably nothing, and go on with your life. Fast forward a few months, and that discomfort has become a constant background noise, a signal that something isn't right. Many people, especially in the United States, ignore these early signs because they don't cause immediate pain or disruption. They assume it's just stress, a bad day at work, or maybe even just aging. But here's the hard truth. Ignoring those early warnings can lead to dangerous complications down the road. Research shows that subtle signs, like occasional chest tightness, shortness of breath, or even unexplained fatigue, can be early indicators of heart disease, and by the time more dramatic symptoms show up, the damage might already be severe. Take the story of Mark, a 52-year-old accountant from Ohio. Mark was always busy, juggling work and family, and he often dismissed his occasional chest discomfort as just a passing thing. One day, after a mild workout, the discomfort turned into severe pain, leading him to the ER, where doctors discovered he was on the brink of a heart attack. His experience isn't isolated. It's a wake-up call for many Americans who ignore their body's signals until it's too late. Let's start with the most obvious sign: chest pain. But here's something many don't know. Heart-related chest pain isn't always the crushing pain you see in movies. It might come as a pressure or tightness, sometimes mistaken for indigestion or anxiety. In some cases, people report a squeezing or fullness in the center of their chest. Studies from the American Heart Association note that these symptoms are often the first red flags. Consider Sarah, a 47-year-old teacher from Texas. Sarah began experiencing mild chest tightness when she climbed stairs. At first, she ignored it. Over time, she started feeling short of breath doing everyday tasks. A visit to her doctor revealed that she had blocked arteries forming, a classic early sign of heart disease. Sarah's story is a common scenario, emphasizing that even slight discomfort should prompt a checkup. Shortness of breath is another key sign. It might feel like you're not getting enough air, especially during activities that never bothered you before. This symptom happens because when your heart is not pumping efficiently, your lungs compensate by trying to deliver more oxygen to your body. Research has shown that unexplained breathlessness, even when you're not exerting yourself, can be an early sign of heart failure. In a study published by the Journal of the American College of Cardiology, patients who reported shortness of breath, even without other severe symptoms, were more likely to develop serious heart conditions later on. This means that if you notice changes in your breathing patterns, it's worth getting checked. Feeling unusually tired all the time? This might not just be a result of a busy schedule or a lack of sleep. When your heart is struggling to pump blood effectively, your muscles and organs might not get the oxygen they need, leaving you feeling drained. Fatigue related to heart issues tends to build up gradually and can be accompanied by a feeling of being out of breath with even minimal physical activity. John, a 60-year-old retiree from Florida, always thought his tiredness was just part of getting older. But when his energy levels dropped even more and he started feeling exhausted after short walks, he decided to visit his doctor. Tests revealed that John had reduced heart function, a condition that, if caught earlier, might have been managed with lifestyle changes and medication. Have you ever experienced a fluttering sensation in your chest, like your heart is skipping a beat or racing unexpectedly? These irregular heartbeats or palpitations can be another early sign. While sometimes they might be harmless, when they occur frequently or are accompanied by other symptoms, they could indicate an underlying heart problem. According to research funded by the National Institutes of Health, irregular heart rhythms can be a precursor to more severe cardiac events. It's important to note that while occasional palpitations might be benign, recurring episodes should be evaluated by a doctor. Feeling dizzy or lightheaded can sometimes be brushed off as dehydration or stress. However, if these symptoms happen repeatedly without an obvious cause, they might be linked to heart issues. A weak heart might not pump enough blood to the brain, leading to dizziness or even fainting. Imagine you're driving or working and suddenly the room starts to spin. For many, this is a sign that the heart isn't doing its job as well as it should. A study in the American Journal of Cardiology highlights that recurrent dizziness can be associated with heart failure, especially in older adults. not all heart disease signs are confined to the chest. Pain might also spread to the jaw, neck, arms, or back. This is especially common in women, who often experience heart-related symptoms differently than men. For example, a woman might feel discomfort in her upper back or jaw without any chest pain at all. A case study published by the Mayo Clinic revealed that women experiencing heart attacks sometimes reported unusual symptoms like pain in the neck or jaw rather than the typical chest pain. This can lead to misdiagnosis or delayed treatment, emphasizing the need to listen to your body's signals. The Centers for Disease Control and Prevention, or CDC, reports that early detection of heart disease can significantly reduce the risk of severe complications and death. Preventive measures such as regular checkups, a healthy diet, exercise, and stress management can help manage risk factors like high blood pressure, high cholesterol, and diabetes. Studies consistently show that even small changes in lifestyle, like taking a short walk every day or cutting down on processed foods, can improve heart health over time. It's important to remember that catching these signs early doesn't mean you're doomed. In fact, many people who have experienced early symptoms of heart disease have turned their lives around by making proactive choices. Incorporating regular exercise, a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, and quitting smoking can make a huge difference. The American Heart Association recommends at least 150 minutes of moderate exercise per week to maintain a healthy heart. Regular screenings for blood pressure, cholesterol, and blood sugar levels are essential, especially if you have a family history of heart disease. Even if you feel fine, these tests can catch issues before they become serious. Chronic stress can also take a toll on your heart. Simple practices like meditation, deep breathing, or even spending time on hobbies can help reduce stress levels and improve overall heart health. So let's sum this up. Your heart is constantly working hard to keep you alive, and sometimes it sends out small warning signals that can easily be overlooked. From unexplained chest pain, shortness of breath, and persistent fatigue to irregular heartbeats, dizziness, and pain in the jaw or arms. These are all signs that deserve your attention. Ignoring them might lead to serious consequences later on, but catching them early gives you the opportunity to make changes that could save your life. Remember, the stories of Mark, Sarah, John, and many others aren't meant to scare you. They're there to remind you that paying attention to your body and taking action can be life-changing. By making small, informed changes in your daily routine and seeking regular medical advice, you can protect your heart and improve your quality of life. The key takeaway? Don't ignore those subtle hints. Listen to your body and act on the signals it sends. Whether it's scheduling that checkup, talking to your doctor about your symptoms, or simply adjusting your lifestyle, every small step counts. If you found this video helpful, hit that subscribe button and join our community. We share more insights on health and wellness that could make a real difference in your life. Stay informed, stay healthy, and take care of your heart. Thanks for watching, and remember, your heart deserves your attention every day. Don't wait until it sends a louder warning. Take action now for a healthier tomorrow.